what we need to focus on right now. There's a significant refinement of role of radiation therapy in pediatric tumors in the last 40 years. There's development of risk-adapted treatment, and you've heard this being talked about all morning or all day today. There's an elimination of radiation therapy in certain low-risk tumors in patient groups, a significant radiation dose volume reduction for higher risk groups through incorporation of intensification of systemic chemotherapy, better surgical techniques. There's current pediatric oncology treatment guidelines and protocols for high-income country. They may not be applicable in a low middle income environment. So you may try to derive those guidelines, but it is frustrating because patients can present with late stages. There's lack of advanced surgical techniques. There's limited supply of chemotherapy drugs, and there's inadequate number of radiotherapy machines. Now, so what is availability of radiation therapy globally? So if we look at radiotherapy machines per million people, and as you go from red, orange, yellow to green, you can see the less resources you have, the more red and orange and yellow it is. And green, as it's obvious by looking at the map, are the ones that have a lot of resources. So there are many parts of the world where radiation services are in short supply, and you have such a large population to treat. And bulk of the patients that come to you are going to be adults. So the children, compared to adults, they present for radiation therapy and they may be sick. The children may be in the midst of undergoing other therapy. So we call this chemoradiation. They may be getting IV treatment and on the same day need radiation, such as they may also develop organ dysfunction related to radiation therapy or related to an underlying tumor. They may also be mucositis, for example. The common occurrence of children tend to have a more upper respiratory viral illnesses generally compared to adults. So the child may be in the middle of therapy and has an upper respiratory infection or a febrile illness. We may consider them to be at sedation risk. And a decision needs to be made. Do we continue the daily therapy under sedation or anesthesia? But we have risk benefits of continuing that versus delaying treatment, which also has risks. So this needs to be very carefully considered between radiation therapists, anesthesiologists, medical oncologists. So the communication between all the subspecialties, and it's got to be is critical.